we are back with question and answers right now. So a lot of questions that were bombarded in Instagram is going to be answered by our top-notch doctor over here. So you're very lucky. He's going to clear out your doubts. So let's get started, doctor.
So the first question is muscle pain. Do I rest or continue to work out? Okay, two things. If you're someone who's constantly working out, selalu workout, and then you're having some muscle pull or pain or something like that, stop. Check it out first. Rest for a few days, and then if the pain is still there when you're not working out, go and get it checked. Alright? For newbies yang baru-baru start nak workout ni, muscle pain is something that you tak pernah rasa. So
yeah, you're bound to,
so
want to sleep.
if there's no pain, that means you're not doing it right. So if there is pain, congratulations. That means there's something working out. Your muscles are starting to get stronger. So that kind of pain, for starters, maybe today you work out, you stop one day and then you take a rest that day and then you continue again. Because if you wait until the pain goes off, seminggu dah cukup. Alright, so the next question is tips for vegetarians for muscle gain. Again, you have to, this thing I want to tell a few times. First of all, get to know your body composition dulu. Berapa banyak lemak dalam badan kita, peratus lemak, berapa banyak muscle, peratus otot dalam badan kita. The other two things yang constitute weight is your berat tulang and kandungan air dalam badan. These are the four things that you have to know that makes up your total body weight. Okay? Satu-satu benda, few things that you can lose lah. Your muscle and your fat. Your body water also you can lose. Some of these sleeping centers, they use this body water. So today you might lose 5-6 kilos, and then you can, oh, I'm happy, I lost weight, and then after a few days I'm back to weight again. So that's water loss. Okay. Bone tak boleh hilang. Okay. Pathological. Something wrong, then you can lose bone weight lah. Otherwise no weight. Alright. Muscle loss is also pathological. You don't want to lose kekuatan otot or your muscle percentage. The only thing that you nak hilang is your body fat.
Okay.
Okay. So for vegetarians, when you are telling me that you want to gain muscles, of course you can. There are a lot of vegetables and other sources that you can get your proteins from. Of course, some things like your vitamin B12 and your micronutrients and all those are obtained only from certain meat sources. But otherwise, yeah, vegetarians you can beat up on your protein levels, your pea protein, your milk, whey, casein and all those are still vegetarian sources of protein, and you can take all those as for muscle gain. And of course, do more muscle gaining activities and workouts, not cardio. That's the most important thing.
Yeah, and I think we have to discuss about where the testosterone and estrogen comes into play.
Yes.
Because some of the soy-based product is high in estrogen.
Yes.
So you have to know how much you're taking, and you have to also do workouts that increases your testosterone
levels. Alright, so for guys, you have testosterone which is 10 times more than women. So your muscle gain is faster. As for women, don't be sad. You have a certain amount of estrogen, and if you do those workouts which are more muscle gaining, you will hit your maximum potential of testosterone which is needed as well, and then you can get your muscle. Yeah! Next question, sugar cravings. Okay, I think this one we did in the earlier video also. So there are a few reasons that you can get sugar cravings. If you get intense cravings, I would cut it down to two reasons. One is that your cortisol level is very high. So then you want to reward yourself by your dopamine. That's when you do it by giving yourself some cakes and all this kind of thing, simple sugars and all those. So that is because your cortisol or your stress levels might be too high, or it might be too low where it's called adrenal fatigue and you constantly have these cravings. Okay. The second reason is your gut might not have enough of good bacteria and you have a lot of fungal and spore colonies. So these fungal and spore colonies would create that craving for you. Okay. So I hope I've answered that well. Next question is, I am taking less food but not losing weight. Again, go back to the earlier part where I said that you have to see how many percent of body fat you have, how many percent of body muscle you have. The more muscle you have, the more easy it is to burn this fat. Okay, and if you are only looking at the diet constituent, that means jaga makan saja, no workout, it's gonna take a bit more longer for this fat to lose. And also when you're saying that taking less food doesn't mean you're taking the right food. So you might be taking less rice morning and then something less of a carb also in the afternoon and another less of a carb also in at the dinner portion. Then you have to take a look at how much of fiber you're taking, how much of protein you're taking, how much of fats that you're taking, good fats. So it is better to see how many percent of these macros that you're taking rather than saying that you're taking less food. So see if you're taking too much of carbs but you're taking in less portions and what kind of carbs they are. Alright, so that you have to see your macronutrients.
So there's a lot of saying that goes, as long as you are in deficit, you lose weight.
Yes.
So
also, if you're having higher body fat and lesser muscle percentage, that is going to work out very, very slowly. So to make sure that the fat is burned faster, add the workout component to your diet.
So when you're working out, what do you need? You need more protein into your diet, and that also gives you to another approach, which is a thermogenic effect in your body, where you would start burning more fat.
Yes. Alright. And then, is it harder for the person to lose fat, for thin people to lose fat than bigger people? Again, if you are thin, again go back and see what your composition is. You might have higher body fat percentage, but it's mostly visceral fat maybe. And visceral fat, there's no shortcut to lose visceral fat. You have to add both the diet and the workout component as well. And of course, it is harder for the person who is of more body weight or more body fat percentage to lose weight as compared to you. So because they have a lot of subcutaneous fat and also the visceral fat as well. Right? So the next question is hormone replacement therapy or HRT for men above the age of 35. What is your opinion? At the clinic now, we are looking at men's wellness a lot, and studies have shown that as compared to like even 30 years or 20 years ago, men at the age of 35 to 40 have 50% lesser testosterone comparatively 30 years ago. So nowadays we are looking at men who are going towards andropause faster. Also, poor workout, high sugar containing food and all those processed food will drive your testosterone levels down. And especially if you're not doing any leg workouts, men, this is the biggest muscle component and the most weight-bearing muscle in your body, which is able to bear most weight are your leg muscles, your thigh muscles and all those. If you're not working out those, your testosterone levels are going to dip.
More legs days.
I know, I hate leg days, but then it is needed. Alright, so if you're looking at dipping hormone levels, yes, we do replacement with natural hormones, but on top of that, the most important thing is to add the leg days to your workout.
Go for leg days, don't skip leg days.
Don't skip leg days, yeah. You don't want a chicken leg and a big body. Alright?